I am super duper excited to nerd out with you about semi-occluded vocal tract therapy, or SOVT. I think the science is super cool. It's an advanced skill, so don't attempt this until you've already checked out my other videos so that you're nice and relaxed, you're using appropriate diaphragmatic breath support, and you have a good grasp of resonance. All of those are prerequisite skills for semi-occluded vocal tract therapy. If you do it incorrectly, it could cause more damage to your voice. Please do not attempt unless you are with a professional who can confirm you are using the appropriate techniques. Without further ado, let's check it out. Semi-occluded vocal tract therapy works by partially obstructing the flow of air out of your vocal tract. We are going to review various ways of how we can narrow our vocal tract so that it causes back pressure to actually push our larynx down and help get it in a more relaxed state. Some ways that we can do SOVT are with straws, buzzing, lip trills, and tongue trills. And all of these methods work to create back pressure. This back pressure makes it easier and more gentle for us to turn on our voice. And instead of that complex way that they vibrate, they now start to hit each other in a more flat way, which distributes the pressure more evenly. So when they're coming together, it's more gentle and easier on your voice. It also causes your vocal folds to be slightly pushed apart so that the vocal folds barely touch each other, and it is much easier to sustain your voice for long periods of time. The back pressure also actually widens the throat, making that resonating cavity bigger and impacting positively the timbre of your voice because your resonating cavity can then vibrate more fully with the harmonics in your voice. The position of your larynx is lowered, and the dangly part at the back of your mouth, your uvula, that's your soft palate, which is actually a muscle, and that needs to come up often when we speak, unless we're saying M, N, and ing. But usually that soft palate is up and tense, and so the back pressure caused by SOVT actually helps with that velopharyngeal closure to get it nice and tight, so that we don't have any air leaking out of our nose, causing hypernasality. Hypernasality sounds like this. It causes less intraoral pressure because there's so much air escape out the nose. What I was saying was too much nasal air escape means that there's not enough pressure for the sounds in your mouth to get those plosive, those clear consonant sharp sounds because too much air is escaping out of the nose. The back pressure requires greater abdominal breath support to combat, which is why diaphragmatic breath support is super duper important for this exercise. We have to be able to reach a certain comfort level using large lung pressures over large pitch ranges while producing only small sound from a small opening. As we do semi-occluded vocal tract therapy, we really want to be focusing on the resonance, the buzzing and vibrating sensations, and we want to be maximizing those sensations. You should be able to feel the vibration in the tissues of your face and in your sinuses and in your skull due to the heightened acoustic pressures in the throat and mouth, your anterior resonance. In the process of progressing from wide, narrow, ow, to narrow, ooh, to narrow, wide, wah, in training, the throat and vocal folds are adjusted so that the economizing effects of a narrowing at the lips are transferred to the back of the vocal tract. The oral cavity can be adjusted for any vowel or consonant. The really cool thing is that SOVT works not only while you are doing it, but there are carryover benefits, meaning that throat and vocal modifications are there during and after the exercise. It results in improved abdominal breath support, better voice quality, resulting in more voice for lower effort with reduced risk for tissue damage, and it causes stronger anterior resonance, making your timbre that much more beautiful. I found this great quote from Sheila Davies, who is a speech language pathologist at the Graduate School of Audiology and Speech Sciences, University of British Columbia. When SOVT is working well, the voice will become clearer, louder, and it will feel like it has become unstuck. Singers can sing higher and lower with an SOVT than on an ah, and their high notes feel easier. You may have seen professional vocalists use semi-occluded vocal tract therapy. You'll see them doing buzzing, lip trills, tongue trills. You'll also see them practicing resonance. May, me, my, mo, moo. The way we train it is from starting with the most artificial, which has the greatest effect, to the most natural forms of semi-occluded vocal tract therapy, which have the smallest effect. First, we start with large diameter straws, and then we gradually go to narrower and narrower straws. Next, we go to speech sounds that are produced with both the lips or with the lips and the teeth. So the z, z, sounds all produce that back pressure because you are voicing, but there is a restriction in the airflow. Lip or tongue trills, the nasal consonants that we're familiar with from resonance training, and the vowels ooh. Remember, ooh is your tongue high and back, and e. E is your tongue high and forward, which we've also reviewed in resonance training. Next, we go to non-speech exercises consisting of pitch glides. We know that doing pitch glides stretches for high pitches and relaxes for low pitches. Then you can try with simple songs, and then you carry over into speech. Intonation and stress patterns of a spoken sentence may be phonated through a straw. And here are my sources for this information. Dr. Ingo Tietze demonstrates semi-occluded vocal tract therapy with straws. I've included the link there. Be sure that there is no air escaping from the nose or lips. If you pinch your nose, the sound should not change. Make sure your power is coming from diaphragmatic breathing and your abdominals, not squeezing here. And after practicing the following exercises for 5 minutes, it starts to feel like the voice is coming out of your eyes instead of out of your throat. And this is referred to as a high placement of voice. Your voice will feel lighter and there will be more buzzing in your face and head because of resonance. Memorize this feeling and try to emulate it when you speak. If you lose this placement, stop using the straws. Again, you can do more damage if you're using incorrect technique. Okay, now it's time for straws. First, you start with diaphragmatic breathing. You inhale through your mouth, and then you exhale through the straw 3 times without turning on your voice. I'll just do it once, but see, my chest is not going to move. It's all the power coming from my abdominals. My chest hand did not move at all. After 3 breaths, we turn our voice on through the straw. It's effortless voicing. The air is doing all the work. If you feel your chest move as you turn on your voice and you're breathing through the straw, stop your voice and just go back to breathing. After 3 breaths, you're going to add intonation. You're going to pitch glide from a low note to a high note and back down, almost like a siren. Gliding up in pitch requires more breath support, so you're going to have to flex your abdominals more as you get to the higher pitches. After 3 breaths, you're going to change your volume. You're going to start soft with low airflow, then get louder with more airflow, then get softer with less airflow. Importantly, do not purse your lips. You don't want them really, really tight around the straw. You want them nice and relaxed around the straw, but don't let any air leak out. After you've revved your voice with the volume, you're going to pick a favorite song with lots of pitch variation and hum it through the straw. Do not let it escape through your nose. If you plug your nose, there should be no change in how it sounds. I'll do Mary Had a Little Lamb. After several trials, you're going to add resistance. You can do this by either using a smaller straw or you can put your straw in water because the water will add resistance. This requires more breath support because it causes increased back pressure. You're going to have to counter it with your abdominal muscles. Do not squeeze your throat. Now we're diving into some vocal exercises that you can do after straw phonation therapy. You can use vowels with an open airway. Ha, ee, ooh, zoom. The Z occludes the vocal tract. The oo promotes anterior resonance. The farther the lips are extended, the stronger the third formant or the harmonic frequency in your voice, and this helps with resonance. And the M helps with that anterior nasal resonance. The next technique is hand over the mouth to reduce vocal tract constriction. You want to open your mouth and place the palm of one hand so that your mouth is almost but not completely covered. Sustain a neutral vowel. Don't try any specific vowels. Go for a neutral one like the. Do not inflate your cheeks. You should feel some air going through your fingers and vibrations in your hand around your lips. You repeat 5 to 10 times. Focus on the sensation of an open vocal tract and an easy production of sound. If you experience discomfort from the pressure in your vocal tract, reduce the pressure of your hand against your mouth or reduce your loudness. Then you remove your hand from your mouth and produce an open vowel. Ha. Try to achieve the same sensation of an open vocal tract and easy production of sound. You can try lip buzzes. Sustain one pitch to allow you to focus on breathing, keep your relaxed vocal tract, and sense your effortless production of voice. Pro tip, you can sip some water to maintain moist lips during this exercise. Focus on the sensation of open throat and the sound pressure against the inside of your lips. The target is effortless voice production. So we're going to sustain voice with a buzz, either a lip buzz or a tongue trill, and put a fair amount of voice behind the buzz using abdominal breath support. If you're having difficulty achieving a lip buzz, don't worry, that's normal. Gently touch the sides of your cheeks close to the lips with one finger on each side of the mouth. If the buzz cannot be maintained adequately, it just means there's too much tension in the lips and uneven breath support. Focus on steady breath pressure supported by the diaphragm. Then we repeat this process at 3 progressively higher pitches. Then slide from a low note to a high pitch. We're doing those pitch glides. Repeat this 4 to 5 times, and with each repetition, widen the slide just a little bit, starting a little bit lower and going a little bit higher. Do this task slowly. You're going to practice that revving again, starting with low airflow, then higher airflow, and back to low. They suggest to allow about 2 beats for each part of the soft, loud, soft. Then repeat this on 3 progressively higher pitches. Tongue bubble glides are blowing a raspberry, tongue between your lips and blow. This uses a combination of the tongue and lip trill on upward and downward pitch glides. Repeat those steps with the tongue trill. Next is gargling, exactly what it sounds like. Using some water, use abdominal breath support. Your chest should not move. You do pitch glides up and down, and you do volume modulation. Then you use Z. Then you use E or ooh. E. E. Ooh. Ooh. Then with glides. We were away a year ago. And then your nasals. May me my mo moo. Nay ni nai no nu. Ngay ngee ngai ngo ngu. My source for these exercises was Berman and Haskell, 2008, Exercises for Voice Therapy, Plural Pub Incorporated. How fun is that? Enjoy semi-occluded vocal tract therapy. Don't do it wrong. Double check with your healthcare provider that you're doing the correct techniques. Watch my other videos if you're not sure that you have the foundational components correct. Good luck and enjoy looking silly.